Hey guys, Dr. Kady here on Hey Doc with another episode of our common mistakes that women make when they are trying to fall pregnant series. This is episode 3. If you haven't watched the previous ones, make sure you go back and watch those because they'll be so helpful in your journey to trying to get pregnant, particularly if there've been delays and you're not quite sure why those delays have been happening for you. This is free information for you ladies who have been struggling to get pregnant. And if you are a gentleman on here, make sure that you're sharing this video with your significant other in order to allow you as a couple to finally conceive that beautiful child. So in this episode, the third common mistake that women make when they are trying to fall pregnant is failing to do blood tests. Yes, blood tests. Would you believe that some women, after trying to fall pregnant for several months, still have not gotten around doing routine blood tests? This is important because although you may have confirmed that your uterus and other parts of your female reproductive system are essentially structurally normal, because the female reproductive system is heavily dependent on there being a balance in your hormone levels. And so if there are hormonal imbalances, you may not be able to conceive. Here is a list of blood tests that every woman who's been trying to get pregnant and has experienced a delay should have done by their own physician. Follicular stimulating hormones and luteinizing hormone, also known as FSH and LH respectively. FSH stimulates the development of the follicles within the ovaries in the first part of the menstrual cycle, eventually leading to a mature and dominant follicle that is ready to release an egg during ovulation. LH, on the other hand, is the hormone that triggers the release of that egg from that dominant follicle. Then there is anti-Müllerian hormone, also known as AMH. This hormone is particularly important to measure the levels of through during the blood test if you are later on in your reproductive years, your late 30s, your early 40s, possibly even your mid 40s if you are keen on getting pregnant. But I would also argue that even in your 20s, early 20s, mid 20s, if you're eager and actively trying to fall pregnant and it just has not happened, it would be almost silly not to do an AMH, even in your 20s. Why? Because I have seen young ladies in their early 20s, mid 20s, have a low AMH. In fact, I recall a patient in her 20s whose AMH was literally close to 0. Now, how do we interpret a low AMH? AMH, as I mentioned before, tells us how many eggs a woman has left in her ovaries. If your AMH is really low, in fact, it's below the lower limit of normal, it tells us that falling pregnant is going to be rather difficult because during a cycle, it's not just one egg that is being stimulated to develop. Multiple eggs are being stimulated to develop, and only one of those follicles is able to release a dominant egg. So if you don't have many eggs left over in the first place, yes, the FSH will stimulate your ovaries, but because you don't have many left over, even with the small number of follicles that you have left over, you may not have enough follicles, one of which will be dominant enough to be able to release an egg. So low AMH means fewer follicles and fewer eggs in your ovaries. So the chances of you falling pregnant naturally is very slim. So if you have a low AMH, why waste time, emotions, and possibly even money? You and your partner may at that stage be able to make the decision alternative options in terms of you having a baby. So ladies, if you've been trying to have a baby for any length of time, remember AMH, very important. Next is checking your thyroid gland, doing a thyroid function test. So your thyroid not working properly can affect your ability to get pregnant in several different ways. Now, remember, there is overactive thyroid and there is underactive thyroid. I have done a video on this channel looking at the malfunctioning of the thyroid gland. I will leave a link to that video in the description box. I will also do a separate video looking at thyroid dysfunction and how it can stop you from getting pregnant. We will look at it in details. But remember, this video is just a very short snippet about different things that women need to address when they're trying to fall pregnant. So I'm going to try to not make this video too long. But in essence, how a thyroid gland that is not working properly can affect your fertility is by causing irregular menstrual cycles, which will lead to periods or cycles in which you did not release an egg. So these are called anovulatory cycles. So if your thyroid is not working properly and you have an underactive thyroid, also known as hypothyroidism, what could happen is that the phase in the menstrual cycle that is between the phase of the day of ovulation, not the phase of ovulation, but the day of ovulation, right through to menstruation when you start bleeding, that phase is known as the luteal phase. It's important for the luteal phase to be of a certain number of days. If it's not and it's shorter, which will happen if your thyroid is underactive, it will affect the ability of the fertilized egg to implant itself. Also, what is seen in patients whose thyroid is underactive is the level of the hormone known as prolactin being elevated. And high levels of prolactin goes against ovulation, so it stops ovulation from happening. So if you are not ovulating in the first place, you are not going to fall pregnant naturally. So again, another reason why doing a thyroid function test is absolutely crucial if you've been trying to get pregnant and it's not happening naturally. Finally, another reason why knowing what your thyroid function is so important is because if your thyroid is overactive, remember there's underactive and there's an overactive thyroid. If it's overactive, you are at an increased risk of miscarriages. This leads very nicely on to us talking about the hormone level I have mentioned previously, which is prolactin. So you must do a blood level for the prolactin hormone. Prolactin is an important hormone that is released by part of the brain. It's involved in a complex chain of reaction, which I will spare you the details of. But essentially, high prolactin levels impairs the ovary's ability to respond to FSH and LH. High prolactin levels also disrupt the menstrual cycle and leads to irregular periods. Sometimes if a woman has high prolactin levels, she may go many months without having a period. And obviously that's going to make it very difficult for her to know when it is that she's ovulating in order to be able to time intercourse. Another hormone that is important for you to get blood tests done for is progesterone. This hormone tells us if you are ovulating in the first place. No ovulation, no pregnancy. Or maybe I should say, no ovulation, no means of getting pregnant naturally. I think that's a better term. The fact that you are not ovulating is not complete loss of hope if you are trying to fall pregnant, because we are in an era that there are ways of retracting your eggs from your ovaries in order to get you pregnant by other means. So knowing your progesterone level is very important. Now, the ideal way of measuring your progesterone correctly is to do it between day 1 and day 5 of the menstrual cycle, and to do it again at day 21, at which stage the progesterone levels should be higher than it was between day 1 and day 5. If we observe a rise in your progesterone levels, it confirms that you are indeed ovulating. So if your body is releasing an egg, then obviously you have sperm swimming through the cervix, getting into the fallopian tube. In theory, if all being well, you should be able to get pregnant naturally. Now, if that rise in progesterone does not happen, it just means that it is very... And first of all, it's important to say, if there is no rise and we do it month 1, month 2, month 3, month 4, if you can afford to do it that many times, it just means that it is likely that you do not ovulate. And so why waste more time? Let's go straight for the other alternative ways of getting you pregnant. Remember, these videos are to save you time, save you emotions, so that you're not waiting a long time, trying and sexual intercourse is just not working. You are knowing what you need to do early, so that if trying to fall pregnant naturally is unlikely because you have identified certain of the things that I'm talking about in this series, then you are having that discussion with your partner and saving time and going for other ways of getting pregnant and saving yourself all the frustration. It's not to say that you can't get pregnant if you've identified one of these things being an issue or something's wrong. No, it's just to say, okay, getting pregnant naturally, it's unlikely to happen because we now know that this is wrong. Let's go for other alternative methods early. Here's a bonus one for you ladies. If you are actively trying to fall pregnant naturally and you are very serious about it, I would argue that you need to have a thorough sexual health screen, particularly for chlamydia and gonorrhea and trichomoniasis and bacterial vaginosis. Let me explain. The first three, chlamydia, gonorrhea, and trichomoniasis, these will lead to infertility. So they cause scarring, they cause infection, inflammation, and scarring, particularly within the narrow and slender fallopian tubes. So if they are left to brew for some time, they could lead to blockage of the fallopian tubes. I have done two videos on this channel about the causes of blocked fallopian tubes and treatment and how you can fall pregnant despite having blocked fallopian tubes. If that interests you, check out the video that I will leave in the description box. But back to the purpose of this video, get a full sexual health screen done. The proper way of doing a screen for these conditions, for chlamydia and gonorrhea, is for you to get the first catch of urine that has been sitting in your bladder for 2 hours or more. So it doesn't necessarily have to be an early morning urine, but the urine needs to have stayed in your bladder for 2 hours and longer. As long as that's the case, you need to get the first catch, the first bit of the urine that comes out. That's what you need to catch to return to the lab. If you don't collect it the right way, it will not identify these crucial infections that can stop you from getting pregnant. That's one. To test for trichomoniasis, again, an infection, the very fishy smell that can stop you from getting pregnant, you need to do a high vaginal swab. It can only be identified through doing a high vaginal swab. Bacterial vaginosis. You may fall pregnant quite all right if you have bacterial vaginosis. However, ever. If you have bacterial vaginosis, it increases your risk of having a miscarriage. So bear that in mind if you're trying to fall pregnant and you're doing all of your workup. Those infections are worth you screening for. I hope that's been helpful, ladies. I will continue to do these videos until I get more of you ladies writing to me, giving me testimonies about your God-given babies, your God-given children through God's mercies. Thank you so much for watching as always, and we will see you in our next episode and our other videos that we will do some weeks, months, and years later. Take care. By the way, do remember to subscribe, like, share. It really helps this channel. And continue to watch so many videos that we have on here about general health stuff, about women's health, and about one of our favorites, fertility medicine. Take care, and we will see you later.